Well, greetings. This is Dr. Bill White again with the American Orthodontic Society, and I want to talk to you a little while this afternoon about the anatomy of this palatal separation. Somebody came up with this years and years ago, you know, and then it improved, and this went on for a while, and they learned they could push the palate apart, and the sutures in the palate have no nerve endings, so the sutures just tend to come apart in here up to a certain age. But the way they did the pressure to bring this apart was not right, and I figured out a way later on to get the pressure where we needed it, and was able to do a lot of people that they thought couldn't be done, in which they use surgical intervention to help separate the palate. So this evening I want to try just to see if we can understand a little more about palatal separation. Now, I've been doing this for nearly 60 years, and I have never had one bit of trouble with the palatal separation problem, nose bleeding, or something else bad wrong with the person because you tried to separate their palate. And I read a whole bunch of stuff on this the other day just to see about this surgical intervention in here. Now, personally, I've never used the surgical intervention, and didn't find a case where I just had to have it. Maybe that's wrong. I have nothing against a surgical intervention if it does what you want it to do. But if it's not moving the teeth out and developing the airway in here, then it's not doing what I want it to do. The actual palatal separator does that. It brings it on out. But you darn sure don't do it with some little old bar up here against the teeth, or a chunk of acrylic, or things like that. You push on it, the teeth got to do this. You got to have something rigid in there that when you push it apart, it will go apart with the roots parallel. And as this gets wider up here, you get more airway in there. Why are so many palatal areas today short? They're misformed and stuff like this. Now I want to touch on that just a little bit. Now this, when we're going to separate somebody's palate, we use a palatal separator. You can order them and buy them with different shapes and kinds and different things about the palatal separator. And normally it's a deal set in here somewhere. It's got some screws going out like that. Maybe it's further up this way. And the arms, you take one of the arms over here would go and you attach the two bicuspids to it. Now this isn't a grown person that at least has a bicuspid. We put these on little kids and push against deciduous teeth. The other comes over here, and you can go back and catch the second molar if you want to. I've got my picture all screwed up, but you got the idea. Here is the suture going right down through there, and we're going to push this apart by expanding this thing right there. Now on the next picture in here, I'll show you. This is a palatal separator. This bar goes out and catches the second molar. If the second molar's good, it'd be good to band the thing, stick it in there with it. We put bands on these two teeth, in fact all of the teeth in here, and I've been doing these for so many years till we have pretty well learned how to do it. I was down in Puebla, Mexico, and had a lady in there, and she brought her son in, and she says, he's been in there and they put this thing in, and it's been cemented 3 times, and it comes out every time. And I said, well, there's something wrong here. You're not doing this. I have never had one of these come out of the mouth while I was waiting to get it cemented in. Now, that's a smart thing, but I have never had one come out like that. And so the lady, I kept talking to her like she was a housewife, and after I got along, I said, she said, I want you to do this again on my son. And I talked to her a little more and found out the lady worked in the orthodontic department at the university there in Pueblo. And she may have been charged in the orthodontic. She never said one word. And we did that. So we put a new one in, and to my knowledge, it never came out until they took it out, and we separated the young man's palate and pushed it apart. So anyway, that's just a add-in thing that was stuck in there. Now, if I go to a skull picture in here, these are turbinates. There are 3 turbinates, the lower, the middle, and the upper turbinate in there, and they're on each side of the palate. Now the palate has been sectioned into, the teeth would be down in this area. But I wanted to show these are turbinates, and there's on each side of the mouth up here. We're going to separate this palate. This portion up here will go to the right, the other one to the left, and we're going to separate this. Now, this is the nasal septum, goes down through here, and there's one thing that's been questioned in my mind ever since I've been doing these things. The nasal septum is very thin, and it just runs right up between here. Sometimes it's squeezed over here, and it has a deviated septum and blocks the airway, and so you have to mess with it that way. What happens to the nasal septum where it's thick in here? Apparently it separates here, and in this part, one of the septum will either go one way or the other way in there, so this little thin bone structure is not going to be separated. So we'll go through that part, and I'm going to try to hurry through this. I know everybody's in a dadgum hurry, and they don't want to sit down and watch and learn something about it. But this is a skull that I was able to get a hold of about 50 years ago, and you can't buy them now, and show a few things about it. This is the sinus in this area, and it opens up and you can see the sinus, and this is of course the middle and the upper turbinate, and the turbinates swell up in here and they stop the airway, and so you got problems with them. So we were kind of concerned about keeping the size of these down. I had to go in recently and have my the opening between this sinus and my nasal cavity opened up and blocked, had been closed, and it changed my voice a little bit. So this is that portion. I want to rush on through here, and here we've taken the sinus, and this is a picture of the sinus, and it drains somewhere into the nasal cavity in there, and then mine did that, and the whole sinus was full of old thick junk. Now here's looking at the turbinates from the back side. In other words, if I just took the skull and went around and took my camera picture from here, and you can see the lower turbinate, the middle, and the upper turbinate is pretty small in this area. This is a nasal septum right there. Let's get on through this. Okay, now here is a picture I want you to look at really hard. Palatal separators, usually your separator is made in something, well, it'd be up in the roof of the mouth up here, and it's got that separate deal, and it goes one bar, this goes here and here, the other goes here on, you get on these two teeth, and you put bands on these teeth, and the bands are cemented in the mouth. Now what you have to do, you have to put some real separation in here and get these teeth apart where you can actually put the bands on the teeth and get them down as far as you can go with the bands, and then you have to take an impression of them in that position, take the impression out, take the bands off, and put them into the impression material accurately so that when you build this thing on the model in there, it'll go back in the mouth. And that's one of the problems. We built our own separators. Now, that is on each side of the mouth and come up and join it. Now, the bars going down there, we're separating material all the way between the two central teeth and the whole palate up here. And we're separating that. We're pushing from an area right here. Now, if I want to separate this bone structure in here, the way we're doing with the palatal separators, we're pushing apart back here about midway. We're pushing back midway. Now, if you want to pull something apart, you don't put it out here and try to pull it apart. You get it up here. So the major part of the bone structure that's being separated is right here between the two central teeth. See, coming across this way. And so this was what's holding it back. I went to Donald Timms, the guy that wrote the book on palatal separation several years back. It's been 25 years ago when I was talking to him, or 12, more than that. And I said, Donald, I called him Dr. Timms, of course, and he had written the book, and he was a fairly young guy. I said, how old can you separate the palate? And he told me, he said about 17 or 18 years of age, the bone, the suture hardens up and you can't get it apart there. And I just turned and walked away because I had already been separating palates in people that were up like 30, 35, and even some into their early 40s. We were able to separate the palate. And why were we able to do that? We put spring pressure between the central teeth over here, and so we had pressure going apart here and pressure going apart here in the front, and we were able to separate palates up until I've had some people come in later in 40s, but most people in their late 30s or early 40s, that's about as far as you could get it apart. But you could still crank on it, and I've spread out a palate on a guy who was like a huge guy, 312 pounds, but I had to crank, and we just kept pushing this palate apart, and it just stretched, or the bone stretched, or maybe the vault went down a little, but the bone stretched, and we got the guy dead. I'll try to show that video on him later on. All right, let me get on quick with this. That's just another view of the turbinates. There this part is. And this is where we're going to put the spring. We're going to attach something to these teeth, and we're going to start spreading that out. And I'll show you the first guy that we did that on, and it opened his palate really quick. And this is kind of where these bars go out like this on here. And so you're trying to separate by reaching out, you see, to separate. And this is where the most bone is, and it doesn't go apart unless you, now this is split down the middle right there when you actually separate it, excuse me. All right, that's the other side of the mouth now with the turbinates, and that's just a view of the turbinates from the back side, and another view of the turbinates. And this is your upper, really close-up picture showing this is where most of your force needs to be if you're going to separate this and come out with that. And so we're doing it from a place on the teeth right down here, which is not the best place in the world to go. And I had to stop practicing before I decided that it would have been smarter for me to put a tad into the tissue here. So I'll show, and the tad can have an opening in it, and you can put a little spring between one tooth or one side of the suture and one side on the other side, and you could get a better push on it. Now, we tend to move the teeth a little, but you do this in a hurry, and we were able to separate with the spring down here and the pressure up in this area of the mouth. So this is what I want to pass on to people. If you're just doing them back here, you will not be able to do the people that you can really get separated. So drop down here anyway, but if you've got tads and screws, go in on each side of these teeth right here, put some spring pressure and shove those teeth apart right there. I'll tell you how to do that before we even start on. So I'm going to run through the rest of this. Now this gets back into the temporomandibular joint. The condyles comes up in here, in this area, and this is the eminence. And as you move your jaw forward out here, the condyle comes up on this, but we're not going to try to cover all that this afternoon. And this is your ear opening right there, but since we're there, I'll mention that. And that's the turbinates hanging down. Now I'm going to stop at this point and hope that you will understand some of the stuff about this. Now, I've had a lot of experience that maybe some of you have not had. I've scrubbed in with old surgeon and we section the whole maxilla off. I mean, cut the thing off up here. And this section that holds maxilla loose and shortened it or something like that. How it grows back, God only knows. But anyway, I'm going to say goodbye on this part.